Hello groupmates and class. Today I'm going to be explaining to you the career path I chose, neurosurgery. Much like physicians, neurosurgeons have a fundamental role in society, choosing correct treatments for patients, running diagnostics, obtaining medical histories, and of course, performing surgery. Neurosurgeons are expected to present themselves clean and organized. Neurosurgeons wear a lab coat, head cap, mask, and gloves each time performing surgery. In briefings and reviewing medical history, however, neurosurgeons can wear dress clothes, or if they own their own office, may wear just casual clothes. Neurosurgeons are expected to carry tongs, chisels, forceps, and many other sorts of tools. Neurosurgeons also deal with x-rays and scanners. The education and training a neurosurgeon must complete is long and difficult. Neurosurgeons must generally complete 4 years of university, gaining them a bachelor's degree, usually in the sciences, 4 years of medical school, 1 year of internship that is usually associated with their residency program, and 5 to 7 years of neurosurgery residency. A neurosurgeon's typical workplace is a hospital or a self-owned office. Neurosurgeons deal with ill and stressed patients. They work long hours, 40 to 60 hours a week, and are on call at any time. Neurosurgeons also work in universities, research labs, and in surgery rooms. They use x-rays and scanners, and many sorts of tools to perform surgery. Whether a neurosurgeon works 40 to 60 hours a week or is on call day or night depends on the employer. If a neurosurgeon is employed by a hospital, he or she is on call day and night and does work 40 to 60 hours a week. Owning your own office, however, you choose your hours and if you're on call or not. A typical neurosurgeon can make around $100,000 to $300,000 a year, or more if they work hard. Benefits all depend on the employer. If you're self-employed, no medical benefits are included, but you get to choose your hours and as much vacation time as you'd like. If you work for a hospital, medical benefits are included depending on your contract, as of with vacation time and overtime. Schedule, as well as income and benefits, all depends on the employer. If you are self-employed, you may choose your hours, but if you are working for a hospital, you typically work for 40 to 60 hours a week. Overtime depends on work completed that day. A neurosurgeon's typical schedule goes like this: an overview of medical records before the patient arrives, and a briefing before surgery, then the operation at hand. This cycle continues twice a day. As I said previously, the path to neurosurgery takes 15 long years of education. After becoming a neurosurgeon, there is no other further advancement in this field. Some pros to being a neurosurgeon are that you get to help people, and on your path of education, you get to learn a ton. Some cons are you have to work with stressed and ill patients. There's a lot of paperwork, and you can cause injuries and certain death. I hope you enjoy my presentation and know a little bit more about being a neurosurgeon.